patient from bed to chair. Okay, and we start from the beginning actually. I have to come introduce myself to the patient. Hi, Mr. Ibrahim, how are you today? My name is Samiha. Yeah, whoever, Ali Ibrahim, Thomas, whoever. Mustafa, okay. Hi, Mr. Mustafa, how are you today? My name is Samiha, I'm your patient. I'm your patient. I'm your physiotherapy technician today. I'm going to help you transfer from bed to chair because you need to spend at least 2 hours in the morning session on this beautiful chair because it will help you breathe in a better way. Okay, so I introduce myself. I go wash my hands, wear my gloves. Okay, this is very compulsory. We don't forget about hygiene and PPE. Okay, and then we come back to the patient. First thing I have to do is that I bring my chair. I put it next to the bed. And usually we put it on the side of the strongest leg. Because if the patient is going to stand, he's going to lean on the strong leg. So it will help him more, okay? Anyway, so it's mentioned on the file, what are the comorbidities of the patient. You know what are the limitations in movement that he has, so you know which leg is weaker than the other. I'm not going, you can go for ROM, of course, before doing this. Otherwise, it's just to save time now. You know the situation of the patient, so you know which leg is stronger. So, I put the chair next to the bed. Very, very important is to lock. I have to lock the chair so that it doesn't move, and they have to open the footrest.
The safety of the patient.
Yeah, for the safety of the patient, of course. And then I talk to him. I ask him to cooperate. So, Mr. Mustafa, we will start now. If you can please cooperate with me. The bed can be flat, but usually what PTT do is that they put the patient in Fowler's position. Fowler, that means he will be sitting like 30 to 40 degrees. Okay, so the bed will be up. It will help you also for safety of your back. So I'll explain. I have always to explain to the patient what I'm going to do so that he doesn't get scared and he anticipates the steps. First thing, I ask the patient to come closer to the edge of the bed because he's a bit far away from me and it's strenuous for my back to bend. So I want him to come over. If he cannot, I have to help him, obviously. So I do bring him to the edge of the bed on 2 steps, the top part and then the lower part. Then, Mr. Mustafa, we are going to move. So in one move only, I'm going to lift you up in a sitting position and then put your legs down. So one arm has to support his neck and the other one support his legs. So 1, 2, 3.
Very good.
4. We said sitting. Don't jump.
Sitting.
So, I don't know what he did. Okay. Second very important thing is to make sure that his legs are between my legs. And this is for his safety so that he doesn't move, he doesn't fall down. And I ask him, so now please, I need you to put your arms above my shoulders. You should be more flexible. Actually, this is very difficult because it's very difficult. I pass my arms around the patient.
This patient.
And you cannot see it, but you don't cross your fingers, they can detach. You don't also hold your wrist, it can detach. You hold your arms, okay? So behind the back of the patient, his arms are around me. I hold my arms. So, Mr. Mustafa, ready? We are going to stand. We will just stand. We will come down of the bed. At the count of 3, you come down.
3, 2,
1, 2, 3. It's standing, right? I can feel it. Okay, so now third step, we are going to turn towards the chair. So when I count 3, you have to turn with me. My leg is always supporting his weak leg, so that he doesn't fall, he doesn't fail. Okay? So 1, 2, 3. This is one step. Sorry. So this is one step only.
No bump.
considering one step. Can you feel the chair behind you? He said no. So we can go back.
Yes.
Can you feel it now?
Yes.
Yes. So now at the count of 3, you're going to sit. 1, 2, 3. His arms should be here, but as you can see, he's still at the edge of the chair. This is unsafe. I don't leave the patient by himself. Some PTT use towel or bed sheet, they put it on the chair, okay? So they can come from behind and pull the chair, the bed sheet, it will pull the patient with him. Otherwise, in this case, if I ask the patient to cooperate, if he can just go back, left and right by himself, that's very good because you ask the patient to move his muscles and his body. Otherwise, you help him, so you hold him and you take him back. He's not flexible. Okay. Sorry?
If the patient is heavy, if you don't have to provide more the patient exactly, you can move left and right also.
Yeah, that's what I said. You ask the patient first to cooperate. We are supposed to encourage him to move if he is able to. So you ask him just to go back left and right, and they usually do it. Otherwise, you have to assist the patient. You cannot just wait. And you help him also to rest his feet on the footrest. He is safe. Dignity of the patient, we cover him. Usually they are in gown, so their legs are open. You need to cover them. You ask him to sit on the chair for 2 hours. You can explain the benefits of sitting on the chair. It helps the patient to breathe very well. It increases the level of saturation in oxygen. It prevents edema or effusion. We call it effusion, pleural effusion. That is the accumulation of fluids in the lungs or around the heart. Okay, so we explained to him it's good also for him, like to move, not to spend the whole day sleeping on the bed. We cover him. We ask him to stay on the chair, of course safely. If there are relatives, they'll be around. I go remove my gloves, wash my hands, and I have to document that I transfer the patient from bed to chair safely without any incidents. If it happens that the patient falls from your arms, anything, you have to note it so that they can do the right investigation later. Okay? So this is step 1.